Hello, I'm Tracy Shulsinger, a family nurse practitioner. I'm here with Dr. Joseph Cohen, and we are here to discuss functional medicine and cannabis medicine. So, Dr. Cohen, can you tell us about functional medicine?
Yeah, I started practicing functional medicine approximately 15 years ago when I first went to a conference and realized that there's a lot more to medicine than just medications and procedures. Functional medicine is really more about nutrition, lifestyle, supplementation, and looking at triggers of disease. And we found in the past 6.5 years since we started practicing cannabis medicine, in addition to functional medicine, that we were getting much more dramatic results, much more positive results with patients.
So with cannabis medicine, how does that interplay with functional medicine?
Well, cannabis is a natural plant herb that just falls right into a functional medicine type of practice, which is what we have at Holos Health. When you have a plant medicine that can work as an adaptogen, meaning it creates homeostasis in the body. Homeostasis means balance. When you have a plant medicine that can do that, it aligns very well with the whole functional medicine type of philosophy.
And how is cannabis an adaptogen? How does it actually work in the body?
Well, in order to understand that, we need to have an idea about the endocannabinoid system and how it works. And it all started 600 million years ago with sea squirts who developed an endocannabinoid system to begin with for balance and homeostasis. Through evolution, all animals have an endocannabinoid system. It turns out the plant came around about 25 million years ago and had the exact same components or compounds that are found in our own body, known as our endocannabinoids. The two main endocannabinoids that we have are known as anandamide and 2-AG. We have receptors. Receptors are in our brain, in our immune system, and throughout our body. Receptor is like a key into a lock. You have your endocannabinoid, anandamide or 2-AG, that fits on a receptor. The receptor is the lock part, and it fits into the lock just right so that it turns something on or turns something off. And that's the way receptors work. So now in the plant medicine, we have different components that act very similarly to the anandamide and the 2-AG, our own cannabinoids that we make, and can also turn things on and turn things off. And what it does, it actually is there to keep everything in balance.
So we have an endocannabinoid system, just like we have other systems like the sympathetic nervous system. This is a natural system everybody has as well. We have receptors, and so that helps it be available to reach our cells. That is very cool. And then the adaptogenic effect helps balance everything out by going the reverse order through the synapses. So it's a very intelligent system.
It is a very intelligent system. It's interesting that it wasn't discovered till early 1990s that we had this system. Even though THC was discovered back in 1964, we have an amazing system in our body that we're just now learning about.
For a patient who's coming in and starting off treatment for the first time with these different types of conditions, how do you help them find the right method for them to use?
Well, we have to do first get an idea what their lifestyle is all about. So an example would be if we want patients to inhale, then we would recommend vaporization. The old-fashioned method of inhalation would be either you have a pipe or you have a joint, and you would put your bud in the pipe or roll a joint and you would smoke it. The problem with that is that you're getting carcinogens when you're smoking. So not only are you getting carcinogens, you're getting odor, congestion, sinus problems. You're getting all types of adverse effects from smoking.
Mm-hmm.
When you actually vaporize, where you're actually taking a vaporizer and you're loading the vaporizer with cannabis instead, you're eliminating the smoke and the burning of the cannabis, which gives you carcinogens. So when you actually vaporize, it's very clean medicine that goes into your body.
So you're inhaling with either using a pipe or a joint or vaporizing, but the vaporizing method sounds like it's healthier.
Much healthier and a lot easier for patients to handle.
So what's the difference then? If you're still inhaling, what makes this healthier? What's the difference?
Because you're eliminating the smoke and the carcinogens and the cough and the sinus problems.
Okay, so with this method, you're using fire.
Yes.
So it gets hotter and it burns.
Exactly.
And with the vaporizer method, there's like an oven inside the vaporizer?
Yeah, you actually are heating the cannabis up to a certain temperature. With this particular vaporizer, which is the PAX, which is actually my favorite vaporizer, you have different temperature controls. So you can set the temperature on it, and so that it's smooth going in.
Okay, so a healthy method is definitely preferred. And then why else might somebody prefer to inhale versus using another route of administration?
Yeah, the big advantage of inhalation is that inhaling cannabis is fast acting. You get immediate results when you inhale. It's also short acting.
And what other methods do you have here?
So we have a variety of different things. These are tinctures. This is one that we recommend to patients all the time, made here in Colorado. The reason I like tinctures is because they're very easy to dose. Tinctures are drops that go underneath your tongue. So you would just take the cap off and you would either count the number of drops underneath the tongue that you want to have for your dose. But the great part about using tinctures is that you can very precisely dose a tincture by counting drops.
So this particular tincture says CBD/THC 1:1.
Right.
And so do tinctures come in different strengths with CBD and THC?
Yes, you can get tinctures that are just THC in a sativa or a sativa dominant or an indica dominant strain. Sativas are more daytime, awake, alert, creative, and indicas are more for your nighttime body relaxing and sleep and pain.
Okay.
So they may use a different tincture for that purpose. This is a CBD product. This is actually what's called a nano-emulsified product. It's very highly absorbed underneath the tongue. This is CBD by itself made from hemp. It's probably about a 25-to-1 ratio. To call it hemp, it has to be less than 0.3% THC, but that also makes it legal in all 50 states.
Okay.
So you can actually use a CBD by itself in a sublingual pump and put a couple of pumps under the tongue, just like you would use a tincture, and start your day that way by boosting your own cannabinoids, not having any THC or any psychoactivity. And that's another method I would strongly recommend.
So getting into some of these other methods, I see there's a patch here. Can you tell us what conditions the patch would be good for?
There's a variety of different patches out there. I know of two here in Colorado. This is one that's available. Patches are great for people who want to be a little bit more discreet about cannabis. Also for patients who want a long-term effect, because patches can last 8 to 12 hours. This particular patch says it's good for up to 24 hours. And some people, depending on the manufacturer, will place it on the wrist or the dorsal part of their ankle. Other patients with this method, they may put it on the upper part of their arm or on another bare part of their body to get absorption. It's a systemic effect with patch. It's not a local effect. So when you're using a patch, you're talking about getting the central nervous system, the brain effects. Whereas if you're looking for something that's going to be local, then you would use more of a topical cannabis, which can come in a variety of different types of creams. So realize that a patch is systemic. Creams are for local effects on an area of your body that needs attention, where you have a painful joint or you're having spasms.
Okay.
Edibles are long-acting, but they're also delayed onset. So if you're going to be using an edible, you want to go with a very low dose to start. I usually recommend starting at about a 5 milligram dose, especially for those who are not used to using cannabis. Then you can increase your dose as you need to.
So we've covered a lot of ground today. We started out with the endocannabinoid system and explaining functional medicine and cannabis medicine and different conditions that cannabis treats successfully and different delivery methods. Thank you so much for this conversation. So it sounds like you have a very holistic approach. You're combining cannabis and functional medicine, essentially mind-body medicine.
Exactly, because cannabis is probably one of the best body-mind medicines known to man, because when you feel what you feel when you're using cannabis, it actually decreases stress and everything from that on, from your adrenals on up, are affected. We have a whole team of practitioners in our office that are actually invested in this approach, using cannabis along with a functional medicine approach.
Wonderful. Well, thank you for sharing your knowledge and all of your experience and your expertise with us today. And I hope that you listeners can use it in a way that's effective and healing for yourself or your friends and family.
And thank you, Tracy.
You're welcome. It's my pleasure.